Thanks for staying with us. Now, with the cost of living over the roof right now in Nigeria and an economy many say is failing, individuals and families struggle to get by and businesses are either folding up or relocating. This is especially true for pharmaceutical companies, leading to a massive exodus of big names from the country. This unprecedented move by these companies has further deepened the woes of average Nigerians to cater to their health needs. This has also resulted in citizens resorting to alternative, cheaper, but sometimes less safe forms of medication. However, there are, thankfully, solutions that offer the perfect alternatives to popping pills. Some of them, unfortunately, are less known, especially in Nigeria. One of such less talked about fields of well-being is chiropractic. Today, we are lucky to have a chiropractor in the house right now, Dr. Paul Chima. Good morning and welcome to the program.
Good morning, everybody.
Okay, I know you've been here before, but like I told you, even if I interview you like 10 times, I'll still keep asking you, what is chiropractic? And what's the difference between that and the regular physiotherapy?
Okay, so chiropractic is about your daily movement. Let me use that word. What a chiropractor do is to help you realign your spine and allow you walk freely, do anything you want to do, and sleep well. Unlike the physiotherapy is for rehabilitation. When you are sick, maybe you have stroke, or maybe you had an accident, or maybe you have surgery, you go to see a physiotherapist after the surgery and everything, so they help you rehabilitate. But a chiropractor, if you're having headache right now, I can correct it. If you're having waist pain right now, I can correct it. If you're
what's the relationship between a bone and headache?
Okay, so it's something we are not fully we've not fully understood about the body, is that for every organ in your system, it truncates under your spine, and then people are scared of the spinal cord getting injured by a chiropractor. It's never possible, because we are not treating the spinal cord, we are treating the spine, and the spine is like the beam of this house, of this building. Without a proper structure in this building, you'll be having electrical issues in this building. So that's how that's what a chiropractor do. We realign we realign your spine so that you will not have some compression and some headache. So in fact, 90% of the headache you have is from what's it called, misaligned spine, headache, frozen shoulder, deltoid issues. Frozen, what's it called? Anything frozen in your system. For example, your back is painful, you cannot sleep well, you have sciatic nerve compression. These are all related to compressed nerve. And that's where a chiropractor comes in. It's called stabilization. So it's slightly dislocated, and it's only a chiropractor that can fix it. That's why when Nigerians started understanding the importance of chiropractic, they started embracing it. Even though some people come online and say chiropractors are not supposed to crack your neck, a trained chiropractor knows how to manipulate your system. That is what we are trained to do.
So you just crack bones?
Yes,
and
crack bones.
No pills, nothing, just crack bones, and someone gets well?
Yes, because 70% of the reasons why you have most of those issues is because your spine is not aligned. Everything from your eye to your private part to your leg, your calf, everything, they are all truncated through your spine. Everything, your tummy, some people say they have spinal issues, they have compressed nerve and stuff like that. Whether it is from stroke or insomnia or indigestive system issues, they are all from your spine. If you do research on your spine, you realize that your spine controls 95% of everything that goes through your system.
Okay, just for purpose of emphasis, this is what you've just spoken, but for purpose of emphasis, what are the things that a chiropractor can correct?
Okay, a chiropractor can correct migraine.
Yeah.
A chiropractor can correct cervical spondylosis. A chiropractor can correct
cervical what?
Okay, cervical spondylosis is neck pain.
Okay.
You cannot twist your neck, you can't sleep well. If you sleep anything, you just feel that pain shooting down. These are cervical spondylosis.
Okay.
Indigestion. Insomnia. Yes, indigestion. Insomnia. right? Ulcer.
Ulcer?
Yes, ulcer. So I'm a Chinese trained chiropractor, and the way we are trained in China, right? We are trained to understand that most of the issues we're not talking about if you come to me when you have insomnia or you have ulcer, I will not start giving you drugs. No, there's a celebrity in Nigeria who had ulcer and who had been having issues for a long time, and then when I met him and after I fixed him, he was surprised because he didn't understand how ulcer was related to a compression.
I don't
from the back.
either.
Yeah, but every issues you have in your body, yeah, first of all, if in Nigeria was a country who cares more about his citizens, I'm not saying our government does not care about our citizens, but if our country was a country who cared more about how Nigerians are faring and their health and their well-being, trust me, you see, the Ijaws would have been more empowered and more educated.
Why?
Because what the Chinese did was just to take those local herb guys and merge them with the doctors. So they are not left out. They are not. I hear our celebrity people saying that because they have platform, they come and say that don't meet your jaws, don't clean your ears, don't meet a chiropractor. You're not helping the country. If I'm poor and I cannot go to the hospital, there should be somebody around the corner who knows how to do these things. And what the Chinese government do? What they just did was simple. They took those people who they know that their citizens will be going to, took them and met them with doctors. So the doctors teach them basic things and then understood what they are doing and how it could help. And that is how you got people who could do things that they want me to go to very much expensive hospitals.
Yeah, well, but now that you're talking about the fact that someone is poor or doesn't have that much means to go to the hospital, there should be someone like a chiropractor that is around the corner. Does it mean that the services of a chiropractor are affordable or even more affordable than the hospitals?
Well, it is pocket friendly because with just 50K, you get a chiropractic service. And the reason why I'm mentioning this is because we know the rate of fees 50K, yeah? But what I'm saying in essence is that there are critical issues that chiropractors fix. But there are also issues that just doing a chiropractic service would just fix it.
Because when you call 50K, it's not a poor man's thing. Even when Nigeria is like this, 50K compared to the Naira is nothing. And so, for instance, I had a problem with my lower back, and everybody was recommending, you either go to a hospital or you get Agbo. Mm-hmm. You know, everybody's patronizing Agbo now because they can't buy even paracetamol and all that. So, if I don't want to take Agbo, and I cannot go to the hospital, and I come to a chiropractor, is it like jumping from fry pan to fire?
No.
Cost-wise?
So it is not, because once you meet a chiropractor, what they will do first is to realize what the problem is. They will not just jump on you and give you...
How do you do your analysis and diagnosis?
We have measures, understand, is either we do the X-ray or the MRI, or we have measures. We are trained physicians.
Okay, not just to use your hands.
No, we don't just go straight to the hand and start cracking the body. No, we are trained physicians, so we are trained manually and automatically, which is just the conventional way and the non-conventional. Mm. So I can see you right now and tell you your problem is from your L4, L5, or your C2, C3, or your T4, T5, because we are trained to see, just like when you see a cow that is not aligned, you know how it is. You know how the cow will just be,
wobbling, yeah.
Yes, that is how that is how we are trained. We are trained to first diagnose with our eyes before we even touch the persons. But that is not taking off the X-ray and the MRI, right? But we are trained to be ready now.
Okay.
Understand? Unlike other practitioners, you have to go through the chiropractors are like mechanic. You call us mechanic because we can meet you now, check what the problem is in your system, and then fix it. Yeah.
Call my name, call my Dr. Chima. Okay, so now, You were talking about the fact that Nigeria may not be so concerned about the well-being of their people. Well, they could be doing a lot, you know, at the policy level, but the middlemen are the ones that are taking the money and everything, because a lot of examples abound. Now, but what is the level of reception of this chiropractic in Nigeria right now?
Okay, so
because if you ask me, there are a lot of people who do not know about it.
So in 1990, I think that is 1993, 1990, just thereabouts, before Olusegun Obasanjo became a president. Yeah, I think he became a president in 1999 or so.
Yeah.
Before he became a president, he traveled out and he met a chiropractor, a Nigerian chiropractor, right? And then chiropractor was nothing in Nigeria. Nigeria didn't know about it. And then somebody just recommended, meet him. You're having a lumbar spondylosis. Meet him, and then the person fixed him. When he became the president, that chiropractor worked with him all through his tenures. Nobody knew about it, right? Now that's the president. Now I became a chiropractor in 2017, right? And I came down to Nigeria. I trained in China. I came down to Nigeria. Chiropractic was nothing. There were chiropractors in Nigeria, but it wasn't a big thing then. It was in 2020 lockdown that I started making at least my first millions in it, because people were sitting at home. People were always, you know, on their laptop, and you know, lockdown taught us a lot of things about the body movement and everything. So that was when people started patronizing chiropractic. Yeah, that was when other chiropractors I started hearing about other chiropractors. So right now, chiropractic is a big thing.
Okay.
Nigerians patronize chiropractors. I can tell you that. Like, as in, I go to Lagos. I'm in Lagos. I'm in a tour in Lagos currently. I go to Abuja on a tour. I go to Port Harcourt on a tour. I go to Ghana on a tour. I go to South Africa on a tour. And these are places I go, and I have people patronize. At least if I don't see a number of people a day, I see up to 10.
And just be cracking their bones.
Just be enjoying it. So that is a big thing.
Yeah.
A big thing.
Okay. Apart from the fact that people might want to come to a chiropractor for, you talked about so many issues, even private parts. You know. So you treat erectile dysfunctions.
Yes.
You treat impotency and so many other things.
Exactly.
By shifting their bones.
Yes. Your spine controls.
Interesting. Are you hearing this?
Your spine controls everything in your system.
Yeah.
Your L4, L5 controls your urinary, your
for men and women, right?
Exactly. Yes. Libido, cortisol, stress level, a lot of things in your system.
Okay, that was not the question I was trying to arrive at. The question is, some people might want to come to patronize you for a lot of reasons, but some other people would like to study and become chiropractors as well. Yeah. So does it involve having to, as a must, go to a university to obtain a degree, or there are other things that you can do and become a chiropractor maybe in 2 years or 3 years? Okay,
so currently there's no university in Nigeria that is practicing, that is.
But you went through a university system.
I went to China. Other people went to, I think somebody studied in US and other countries, right? There is currently nobody in Nigeria, not online. Not because chiropractic is not something you read and you say you are a chiropractor. You have to, it's a hands-on training. It's a practical training. 95% of chiropractic system is practical.
Trust me, if it enters Nigerian universities, you'll be seeing it on the board.
Exactly.
There's no practical thing.
So everybody who is a genuine trained chiropractor trained outside Nigeria. Correctly. But we are trying to see if to have an institution in Nigeria which nobody has actually paid attention to that.
But is this something that can be understudied?
Yes.
By, you know, I come to your clinic, I become an apprentice.
Right. Yes. Currently, people have been approaching, but at the same time, the Nigerian system has not permitted us to start training and certifying chiropractors. So if you train under me, you have to work under my certification and under my license. Do you understand? But I cannot license you to go and practice because the Nigerian system has not approved that yet. Even though the last time I went to Abuja, I spoke to some people about it, and they said, okay, they're going to look into it. It has to go through the Senate and all that. But right now, there is nobody who is training chiropractor. Maybe there is, but certifying and saying, okay, you have the license to practice, not yet.
Okay, very, very good. Now, I know that you are saying you're getting a lot of patronage, but it is also possible that it's because you guys are not many. Because if you were, let's say, 500,000 of you in Nigeria, the number of people coming to you may not be as much as that.
No, so you know one thing about, no matter what, Don Jazzy is still the best. Because there was a time.
Calm down. I know where you're going here.
So what I'm
you're talking about that as an individual, being an individual.
Yes. So what I'm saying this right is this. Definitely, in the next 2 years, there's going to be a lot of chiropractors because it's a thing now in Nigeria. But that's why, thank God I'm young. Thank God I have a lot of energy to travel around the world to go do this thing. So when that time comes, I would...
But my fear is, okay, now you have a clinic, you do what you do. I've seen some high-profile people come to you, Super Eagles players, and so many other celebrities coming to you for your services and all that. But once you leave the shores of Nigeria because you have a client somewhere else, maybe in the US or something, your clinic is without manpower.
A chiropractor. Yes, because it is like that right now because I don't want to jeopardize what I've built so far, right? Yes, I can train Nigerian. I've tried training some people. I won't say I haven't, but they want to start today and start practicing tomorrow. It's not like that. The Nigerian youths I've had that they want to start with me, and you know there are some things that are very, very deceptive. Well, I can see you talk now, and I feel tomorrow if you're not in this seat, I can actually talk like you until I'm being given I'm facing the camera. That's when I realized that there's a lot of this is years of practice, right? So the Nigerian youth we have right now, I'm sorry to say this, I'm not saying that they're not good.
Don't be sorry, we know what they are now. Everybody wants to be a billionaire in 2 days.
You understand?
Yes.
I as a medical practitioner, it took me 10 years to make my first million. But how many of us that is coming up now want to take at least even 5 years before you can make your first million?
6 months, it's too
so they want to start.
No, okay, that brings up a question as we're rounding up now. That brings up a question. How do you recognize a true chiropractor? Because now, if you're selling agbo, you are a doctor. You have a small chemist shop, you're a doctor. That's how Nigerians call you. And it begins to get into your head and you begin to do things that you should not do. So some of these people, whether you like it or not, will have clinics somewhere.
Exactly.
So how do we recognize, how do we tell the authentic one from the fake?
Well, as a chiropractor, the first thing I do is to check the person, gaze the person. So if the way you're talking, the way you're gazing to this camera and everything, right? Yes, the license is there, the certification is there, but it's nothing. Because a chiropractor is like a good mechanic. When a good mechanic touches your car, you know. When a good mechanic sees another good mechanic, he knows. So if I see a chiropractor who does not know what they're doing,
but that is you. For me, I might just go to you and then you break my waist before I know that you're not a good chiropractor.
That's the thing, right? It's hard for you to just come to a chiropractor and say, show me a certificate if I allow you touch me, right? It's always not because
so it's difficult.
It's difficult. But I believe within the next 2-3 years we'll have authentic chiropractors too, who will not have to cut corners to say they are chiropractors.
Is it as expensive as being a regular medical doctor training to be a chiropractor?
Yes, it is. I spent in dollars to make it happen.
Yes. Anyway, you're making back your dollars, so that's nice. But anyway, this is how far we can go today, and we're glad that you're here. Now that everybody's looking for alternative medicine, nobody really likes to pop up the pills all the time because a lot of these ones have side effects that you cannot even fathom and all that. So we're glad that we have these alternatives in chiropractic, but let the awareness go viral. That's the thing, and that's why we invited you back.
Working on, they are really helping. Recent time they've really spread the news, and right now when Osime, I finished with Osime, he asked me to post and that he likes what I'm doing, and he will encourage Nigerians to be part of it.
Yeah, I saw Sime, I saw Boniface, I saw some other Igalo,
Yes.
and many other people. I was like, okay.
Even Joshua.
Joshua was quite tall. Can we afford this? That was what I was asking. No, I didn't say that. I said Joshua was quite. But Dr. Chima, thank you very much for your time this morning. I will definitely visit your clinic one of these days before weekend. Today's Wednesday, before weekend. I'll come see what you do and maybe get your services as well.
Sure.
But this is how much we can go for today. Thank you so much for your time.
Thank you for having me.
Yeah. We've been talking with Dr. Paul Chima, a chiropractor. A lot of people may not even have heard that name, and this is not like going to Igbobi and having your bones set. This is a different kind of medicine, but it's very good for you. I didn't know the relationship between what you're facing right now that may not be directly concerned with the bones, but he has just given us that information that everything you're facing might just be related to your spine. And just go and find out if it is something that can be rectified by a chiropractor, and look for an authentic one before you get your spine broken by someone who is not an expert. Well, this is how much we can take on the show this morning. We'd like to thank you for your time and invite you back tomorrow for another edition of The Breakfast. My name is Nyamgul Agaji. Thanks for being there.